morning, everyone.
Good morning.
I'll let you in on a little secret. I normally like to kick these things off with my own walk-up music, like in baseball. And my song is "I Had a Tiger." But I needed my sunglasses and all that to get it going, and just weather didn't cooperate. So, but no, I just want to, on behalf of CHC, welcome you all here. I know you could have been anywhere on this rainy Thursday, but you chose to be here with us. We're super excited, obviously, for this day. It's not every day that you break ground on a new clinic, so we really appreciate you being here. And this project was really made possible from the help of a lot of supporters, a lot of community partners, CHC stakeholders, and not just people that are involved in this new construction project, but a lot of you all that have helped us along the way here in Muscatine in any capacity. I'm a marketing guy, so I know that at the end of the day, the best marketing is still word of mouth. And even if it's just saying a good word about CHC around town, it all helps. And so I just want to thank you all and appreciate you for that. And I love Groundbreakings because they represent new construction, and that's great, but it's not just good for us as an organization, but it's meaningful for the community. And I think if you know CHC, I hope you know that when we provide services somewhere, we are entrenched in that community, and we're a part of that community. And I think this represents our long-term commitment to Muscatine and expanding care here. So with that being said, we don't have a long agenda, but we do have some way more distinguished speakers than myself that are say a few words, and so I'll just ask them to come in this order. First, we'll hear from our board chair, Katie Spain, followed by our CEO, Tom Bowman. Then we'll have the mayor of this great city, Mayor Brad Bark, and then followed by Amy Simler, Vice President of Bush Construction, and finally, Ms. Naomi DeWinter, the President of Muscatine Community College. Thank you.
Hello, I'm Katie Spain. I'm the current chair for the Board of Community Healthcare, and I really want to thank everyone for supporting us today. I'm super excited to be here. See some of my fellow board members as well in the audience, so thank you. Just a reminder that a project like this doesn't happen without the support and dedication of many stakeholders. The plans for a clinic in Muscatine actually date back almost 20 years of conversation, and we're really proud of what we've accomplished, and what we've accomplished already and what we're going to accomplish in the future. So I just want to, thank you again for helping us build a stronger community and a stronger and healthier Muscatine. On behalf of the board of directors, we'd like to thank the following groups and individuals: our local, state, and federal elected officials who have supported not just the Muscatine project, but community health care in the nearly 50,000 patients that we serve annually in our clinics. I'd like to thank Eastern Iowa and Muscatine Community College for partnering with us in this project and making the land available to us. We look forward to the continued collaboration. Unity Point Health Trinity and the Muscatine County Health Department. They've been advocates for us all along the way. To the local philanthropic community, who we trust and hope that they will continue to support us in this long-term mission to equally provide health care and access for all. I'd like to thank Bush Construction, who we trust is going to build us a great clinic to serve this community. And we also would like to thank the staff of CHC, and I personally would like to thank those that I've got to know over the many years of being on the board and friendships I've built outside of that. And I think my other board members would say that most of us can clearly see the mission is in the hearts and the minds of all of our clinicians and staff that serve the communities we are in. So I want to make sure that we also acknowledge that we are serving this community with medical, dental, and behavioral health services, and we want to make sure that this is affordable and accessible to all. So thank you for being here today. Thank you for supporting your community. Thank you for supporting those who are in need of our services. And at this point, I want to turn it over to Tom Bowman, our CEO, And thank you all for being here.
Thank you, Katie, and to everybody that's here today. I'm Tom Bowman. I'm the CEO for Community Healthcare. Many of you may not know, Katie does such a great job of representing our board of directors. Our board is actually made up of a majority of patients that actually utilize the services at CHC, putting the patients in charge of the care that we deliver. And so, Katie, thank you for representing them so well. It's also just about review time for me, so we could talk a lot about numbers and analysis and statistics of why there's a need in the Muscatine community for services provided by CHC, but I will save that for another time. That can kind of get boring. I think what I want to talk about the most and convey today is that CHC considers community health a team sport. We cannot provide a healthy community. None of us in this community can do that without the help of one another. And so I often say that CHC, as a federally qualified health center with special tools and resources to serve underserved communities, is just one tool in the toolbox for any community that wants to improve the lives of their citizens. So we have a great team here, as Katie mentioned, in Muscatine already, providing some of the services that we are going to expand upon. And they can do a great job. They will improve and expand access. They will improve clinical outcomes of the Muscatine community. They'll make sure that people get preventative screenings and treat their chronic diseases. They will give people healthy smiles and address mental and behavioral health issues. That's what we can do at CHC. But we also want to be invested in working with partners to connect people to services that we don't provide within our four walls. And so that's going to be really important for us. As Sean mentioned, we are committed to making Muscatine a healthier community. So we plan to partner with our local hospital and health department on more complex care and public health challenges. We want to work with schools and college systems to improve access to care and address workforce needs if we can. Working with local social service providers, legislators, philanthropic organizations to make sure people access healthy food, housing service or housing assistance, transportation, and a host of other barriers to healthy living. That's really what we're here to do, is break those barriers down. We commit to being at the table anytime Muscatine is working on ways to improve the lives and health of their community, and we will be a reliable partner in those efforts. On behalf of CHC, we thank you for being here today to help us celebrate this new project, and we look forward to working with you all well into the future. I am going to go a little bit off script. I know Mayor Bark is next, but we do have Representative Marionette Miller-Meeks here with us, Dr. Miller-Meeks. I would like for her to come up and say a few words. She's been a great supporter of ours out in Washington, D.C. over the many years that she's been there, and we can't do the work we do without that kind of support. So, Dr. Miller-Meeks.
But like my stature, I'll be brief. First and foremost, thank you so much for sending the invitation to be here. This has been a long-term process of improving healthcare access and facilities here in Muscatine. And it doesn't happen without the support of the community, whether it's philanthropic support, whether it's educational support, whether it's donation of public ground to be able to make things happen. And you know, Muscatine, wonderful community situated between two big giant healthcare in Davenport and in Iowa City, makes it even more challenging. But what you're delivering here through the community coming together, making this happen, is going to be top-notch, first quality, state-of-the-art healthcare, very much needed for this beautiful community. And the partnership we have at the local, state, and federal level helps to make things like this happen. So congratulations, this is really exciting. You saw the sun coming out, so we're being blessed on Easter weekend to be here with all the hope that this brings to the community. Thank you so much.
Well, Sean, I know your walk-up song is "I a Tiger." I joke with people, and mine's "Thunderstruck," which is perfect for today. Well, thanks for having me. Good morning. What a day to gather here on the front lawn of the Muscatine Community College, standing on the cusp of something truly special for our community. As your mayor and as the president and CEO of the Chamber of Commerce, I am filled with pride and gratitude to see so many of you here today, united for a cause that touches every single one of us, which is quality of health care for all. First, let me extend my heartfelt thanks to Tom Bowman and his incredible team. Tom, your dedication to carefully vetting properties across our community has led you to this perfect spot. A place that's not just a piece of land, but a foundation for hope, healing, and opportunity. You didn't just find a property, you found the property right here at the community college. Thank you for your vision and tenacity. As someone who has worked in healthcare, I know firsthand the power of hands-on experience. And that's why this clinic is more than just a building. It is a bridge to the future. Our healthcare students will train at Muscatine Community College, building their skills in classrooms just a 1,000 feet away, not a couple thousand feet away. I did have to Google that. From where we're standing right now. Imagine learning, practicing, and serving all right here in the heart of Muscatine. This isn't just training, it is a workforce pipeline to careers that will transform lives, both for caregivers and patients that they serve. Healthcare is one of the top 3 needs in our community. We've heard it from families, from seniors, from young parents, and from our workforce. Access to quality care for all ages isn't just a want, it is absolutely vital here in Muscatine. And today we're taking a big step toward meeting that need. This clinic represents investment in our people, our health, and our future. It's a promise that Muscatine is a place where everyone can thrive. To the team behind this clinic, again, thank you to MCC for the land, and also Tom and your team. We appreciate your investment in Muscatine and look forward to working with you. Thank you so much.
Well, I'm not Amy. She's over there. I'm Ryan Wellborn. I'm the Vice President of Construction at Bush. We wanted to thank the CHC team for trusting us to be your builder on this project. Want to introduce our team so you can ask them questions later if you'd like. Richard Henning over there in the black hoodie, he's your project manager. Dwight Williams is our superintendent. Drew Harlan is our project engineer, and Steve Pennock is our estimator. He put a lot of effort into the front end to make sure that we were coming in on budget on this thing, which I believe we are. So we've really enjoyed partnering with Vantage and CHC through all the pre-construction efforts, and we're just really, really excited to be here at this construction stage. This is going to be a wonderful addition to the community, and we're just really proud to be a small part of that. So thank you again, and we can't wait to start construction.
I don't have a walk-up song, but I will take suggestions. You can email me at any point. So first, let me recognize and thank EICC Board of Trustees members who are celebrating with us today. Michelle Garvin, Yuli Diaz, Diane Pritchard, our interim chancellor, Dr. Lang-Chi Wee, and many of my EICC colleagues from all locations that we serve. We also have several of our faculty and healthcare students, especially in the back, who took a quick break from their classes to join in the celebration, and we'll see them, I think, when we get to the actual shoveling stage. So more than a building, this clinic is a shared investment in our future. When we were first approached by Tom Bowman and the CHC team to consider collaborating on the new clinic, we understood it was a community-focused project, even if it was occurring right here in our backyard on the campus of MCC. Placing the new clinic on our campus would benefit both our students and our community. And those are the kinds of projects that we're always seeking out, the intersections of the college and the community. We already have long-standing partnerships with Head Start and vocational rehab who serve students and the community right here on our campus. We play an important role in increasing access and availability to high-quality health care in Muscatine. That's why we have programs that train certified nurses' aides, nurses, pharmacy techs, medical assistants, and emergency medical professionals. And that's why we said yes to the CHC Clinic project happening right here. Our own students will have access to CHC services for their healthcare needs. Our allied health students will have access to job experiences, including completing some of their clinicals right here. Our graduates will have opportunities for employment. And this will be the first year we'll be celebrating registered nurse graduates from Muscatine Community College in almost 100 years. Our community members will access the array of CHC services. We'll collaborate on events such as health and wellness fairs. And CHC staff will be able to make referrals to our many programs and services. So this is a community partnership which lifts up the intersection of healthcare and education. And we're so proud to be a part of it. Thank you.
Tom, I guess the sun does shine on Wartburg football. He always talks about Wartburg football. Anyway, thank you, Naomi, and thank you all again. Just want to give a little more special recognition to a few individuals or a few organizations. First, the University of Iowa, who has been longtime partners of community healthcare, and also Todd Hackett and Hackett Construction here locally, who built our current location, clinic location. And of course, again, just a special thank you to everyone from Bush Construction, to our design partners, Conceptual Designs, and the architectural firm, Vantage Architects. So with that being said, at this time, we're gonna, I think, move to the opportunity for some photo ops. Now that the rain has stopped, perfect timing. And again, thank you all for coming. And as far as the media is concerned, after our photo ops, I think we will, our speakers, if you haven't already had an opportunity to speak with them, have some time to do that afterwards. So thank you again.